Good evening, everyone, and welcome to another episode of Protecting the Vision. My name is Dr. Timothy Brown, Director of the National Optometric Foundation's educational webinars that we host every third Monday at 7 p.m. We have different guest speakers on, highlighting different topics and sharing free public information. So tonight we're going to have a great topic that we're going to discuss. Going to be a lot of great information left with you from our fabulous guest speaker that we're going to have on tonight. So I want to encourage you to go ahead and invite your family, your friends. Text them the link. We're on YouTube Live. You can text them the link from the YouTube and invite them to join in on this webinar so that they can receive some of the great information that's going to be shared tonight. We are in the last month of 2025. This is the last webinar that we are doing for this year. And I'm so excited to have my friend, my guest speaker that I'm going to introduce later on the show with us there. We are both graduates from the Pennsylvania College of Optometry, and I'm excited to have her on with me. Before I do, I would just like to tell you a little bit about who we are as the National Optometric Foundation, the National Optometric Association. The foundation is the financial arm. We support the association in various ways. We support them by tagging along with the doctors and the technicians each year at our National Optometric Convention, wherever it may be in the US of A, and we do free eye exams for the community, underserved, underrepresented communities. We are doing eye exams there to provide care, provide glasses, where we partner with people like companies like VSP. They bring out their mobile truck and they provide frames and lenses, or their prescriptions are put into the frames for patients so that some of them are able to leave that same day with their glasses, and some may have to wait a few days until their glasses are ready for them to pick up. We're excited to be able to say that we are going to be in St. Louis, Missouri, coming up in July of 2026 for our National Optometric Association Convention. Looking forward to seeing many of your faces in the place as we come together again for a great convention. The NOA, they've been planning, they're going to continue to plan to have another great convention for you and for me. So meet me there in St. Louis, Missouri. It's going to be a grand time. We also want to support the NOA and also the NOSA, our student organization, by providing scholarships for students who are thinking about going to optometry school. They're currently in optometry school. Also supporting community leaders who are out there trying to provide and be a resource for the community in various ways when it comes to educating people about their overall health. We're also excited to be able to partner and help students who are trying to go to convention, to attend convention, to be around people who look like them, and also to encourage them to continue their pathway forward to becoming an optometrist. We are a nonprofit organization, so you can learn more about us. We have a website, www.nationaloptometricfoundation.com. We are also on YouTube as the same name, National Optometric Foundation. If you will go and subscribe to our YouTube channel, you can see some of these webinars that we've done over the past 3 years, and you can share those with your family and friends. We have a Facebook page as well, if you will go and like our Facebook page so that you are aware. And then we also would like for you to give. If you like to give and allow us to continue to do the great things that we're doing as a foundation, organization, a support pillar in the community, protecting the vision, $ protecting the vision. Even if you have $5, $10, any amount that you are able to give will allow us to be able to continue to do the great things that we have been doing over the years. Thank you so much in advance. I'm excited to do our last webinar. I want to say happy holidays, Merry Christmas to all of you, Happy New Year as well. Before we get into this webinar, the webinar that we're doing tonight, we're talking about signs and symptoms that patients should not ignore. And we want to make sure that we go over this topic because we know that many times serious health conditions they don't begin with obvious symptoms, and they start quickly with subtle changes that sometimes we ignore or sometimes we explain away. And we want to focus today on signs and symptoms patients should not overlook, especially as it relates to their eye health and their overall body, diabetes, hypertension, autoimmune diseases. These conditions are often called silent because they can affect the body and vision long before the doctor may give a diagnosis. Our goal is to help you recognize these early warning signs, understand how your body may be speaking to you, understand how your eyes can reflect overall about your health, and empower you to seek that help. Be an advocate for yourself or for someone who you may be a caregiver for before these small symptoms become life-altering conditions and complications. Okay, so lean on in as we speak tonight, and we have our guest speaker share with us about the signs and symptoms that patients should not ignore. Let me tell you a little bit about our guest speaker here. Dr. Roselyn Ahuama is a seasoned optometrist and medical science liaison in the field of glaucoma, known for blending her clinical insight with a heartfelt commitment to education. She is a proud 2010 graduate of the Pennsylvania College of Optometry at Salus University, where she earned clinical honors. She also honed in her expertise through ocular disease residency at the W.G. Bill Hefner VA in Salisbury. After residency and throughout her career, she's navigated roles in private practice, worked within the VA system, served as both an examiner and committee member for the National Board of Examiners in Optometry. She has held leadership positions in local optometric association, and she is a fellow of the American Academy of Optometry, where she has served as committee chair, participated in the Floam Leadership Academy, and shared her insights as a lecturer in the recent years. In her current role as a medical science liaison, she's passionate, engaging in scientific communication with the healthcare professionals who deliver treatment to patients. She brings a warm, personable style to her educational engagements, and today she is delighted to share her knowledge and excitement with all of you. Welcome to the show, Doc. We are so glad to have you on the show today, and we're excited and we are thrilled to hear all the great things that you have for our listening audience today. Welcome to the show.
Thank you so much for the great introduction and the warm welcome. It's always nice to be with a fellow PCO grad, so it's a great way to tip off the evening, so representing today. And I just want to say thank you so much to yourself, Dr. Brown, to the National Optometric Foundation and Association for having me. I'm really excited to share a little bit of what I can to the community, and to just share what we can and have a great dialogue. And just want to note that my talking here and my speaking points are thoughts of my own, and they don't necessarily reflect those of the company that I work for, Glaukos Corporation. So I'm excited to get it started.
Absolutely. Thank you so much. And I hope that, because sometimes I don't say these things in the beginning, and then we get into the webinar and get all caught up, but I hope that you and your family have a very happy holiday season. We're in this last month of 2025, and I don't know how it is on your end, but at our office there, Insight Family Eye Care, it's been really busy this last month of the year. Everyone is trying to get in, use their insurance benefits. It has been a roller coaster ride, but we're hanging on there. We're going to keep riding out 2025 in style.
Well, I hope it calms down for you eventually. I've actually become one of those patients. I had a dentist appointment last month, and I got another one in a couple of days. So I'm one of those December comer-inners too. But I know it's a busy season for healthcare, but we'll all get through it, and hopefully we'll have a great new year. So last stretch here. Hopefully we make it all right.
That's right. I'm going to buckle up and take this ride in, fast or slow. I'm going to take it the way it comes here in 2025.
Absolutely.
So you have given us a great topic for tonight, and I want to thank you for that there. Was there any inspiration behind you when it came to focusing on these warning signs that we were talking about that patients sometimes have?
Yeah, I mean, I think that sometimes we can get into talking about things that are very kind of out of touch for people or very nebulous. And sometimes it's the everyday things that happen to us, not just our eyes, but the rest of our bodies that actually can have a lot of implications on our health and how things go. So instead of just being super, super high level, why don't we talk about things that are everyday that we deal with day to day that we probably know friends or family members or ourselves have encountered and help each other just do our best to kind of keep an eye out for things that can help save us in the long run. So just wanted something practical, relatable, things that I have to remember myself. Even though we're doctors, we're still patients. So when I see these
Yes.
signs myself, I've seen a few and I've had to talk to my colleagues and say, hey, can you help me out? Can you look at me? Can you get me examined? Because I know the consequences of some of these things. So I think anything that helps us kind of identify things that we can kind of save ourselves for later is really imperative. So I thought it was going to be potentially helpful and a good reminder for myself as well.
And I love that you bring that up because many times professionals, we forget that we need care as well.
Yeah,
We have busy schedules, yes, but we also need to find time where we slow down and get into the chair as a patient as well. So I'm glad that you
absolutely.
brought that up because sometimes I have professionals that's watching this webinar, they're on YouTube as well. And we're speaking to you tonight. We want you all to know that you should be a patient as well. We appreciate you for the service that you provide to patients. We appreciate you for all the education that you provide, but make sure that you find a colleague who can help take care of you as well so that you're not ignoring some of these signs and symptoms that we may be discussing tonight as well. So thank you, Doc. That's a great point to bring up there. The
Yeah,
body definitely will talk to you, sometimes about when things are going wrong with your body there. So we have to be intentional and make sure that we're listening to these things and make sure we don't delay getting the care that we need. I keep saying this on these webinars here. Don't delay, do it today. So make sure that when we finish this webinar, if you haven't had an eye exam recently, if you haven't seen your primary care provider, try to get on their schedule. It's going to be hard right now because we're at the end of the year, but try to get on their schedule for 2026 and make sure that your face is into place and that you are putting your health care first and making it a priority as well. Um,
absolutely.
so, Doc, I'm not sure what first you would like to share with us, but if you want to have one of the slides up, you can. I know you got some information you want to share with our listening audience there, but I know one of the questions that I wanted to ask you, about some of the symptoms that tend to be most dangerous when they're ignored, and why is that? I don't know if that's coming later on in your slides, but I want us to discuss that as you go through some of these slides that you have here for our audience today.
Yeah, absolutely. We'll be covering a series of signs and symptoms, but if there's anything that you're wanting to add in or ask if it's there, we'll go through all of it and we can answer some questions throughout the presentation and at the end. So feel free to jump in or ask if it's somewhere down the line. Try to pack quite a bit to not be too overwhelming, but we can be pretty comprehensive. So we'll see how much we get through.
Okay.
But yeah, so here we've got the signs and symptoms that patients should not ignore. And so we can advance to the next slide. And Dr. Brown and I talked about this earlier, but why is this so serious? And we just stated, earlier that sometimes patients, including ourselves, can experience symptoms that we're not sure what they are. We don't know if they'll go away or not. We don't know what they mean and what they can ultimately indicate for us. And so being aware of some things to look out for can potentially save us time. That's one of our greatest assets. Money, which is another asset, to not be inefficient in how we're getting treated. Sometimes our vision, and every now and then we can have things that go on our eyes that can actually affect our physical lives. So we want to make sure that we do all that we can to make sure we take care of ourselves for the things that we think are there, and even for things that we don't know are there. So it can be anything from something minor to serious, but we want to make sure we don't ignore those things. And so we can go on to the next slide and talk about one of our first subjects. And this is double vision. And so in the medical world, we call this diplopia. But double vision is when we see two images of a single object. And this is something that can be kind of tricky. So, Dr. Brown, I'm sure you know that sometimes yourself or patients come in and they're like, how can I tell if this is double or if I'm just seeing kind of blurry? So, one of the things I always tell my patients is if we have something that we're seeing double in, is it everywhere? If I'm looking at Dr. Brown, are there two of him? Are there two cars in front of you? Are there two TVs? Or if it's just you're looking at your cell phone, it's blurry there, and then you look up, everything else is clear, that might be more blur than diplopia. But either which way, if you feel like there's a question about it and you feel like that's what's going on, better be safe than sorry. But that's the kind of tip I tell some patients. Just make sure you're seeing two of objects consistently. But when we have that double vision, it can lead to a couple of different things or a number of different things, to be quite honest. And so on the next slide, we'll talk about some examples and give some kind of illumination to what that can be like. So double vision can come in different flavors. And the first thing we pay attention to, and that we want patients to pay attention to, is if this double vision happens in two eyes or in one eye. So if it happens in one eye, we call that monocular. And that can tell us some different things versus whether it happens in two eyes, which is what we call binocular when we're viewing with both eyes simultaneously. So when we have double imaging in one eye, that monocular double vision, it can be due to some general things. One of them, one of the simplest things, is honestly just what we call refractive error. When light's not bending correctly on the eye, it makes things blurry, and that's what we use glasses and contact lenses to correct. So in other words, we're talking about our nearsightedness, our farsightedness, astigmatism. That can cause one eye itself to see things as double or skewed. Another thing that can cause that is a cataract in the eye. And I know cataracts are oftentimes spoken about, but sometimes people don't know truly what a cataract is. So we'll just do a little enlightenment here, that a cataract is when the lens in our eye, which kind of acts like the window, it sits behind the pupil, which is a hole. So we have this hole and a lens behind it, and it controls some of our vision. And we want that lens to be clear to see through, just like you're looking through a window wanting to see the outside. And sometimes that clear lens can become cloudy over time. And sometimes that cloudiness can be universal. Sometimes it can be in patches. But sometimes when it occurs, it can cause one eye to split images and you may see two versus one. So that's another reason we can have that one-eyed or monocular double vision. Another thing can be corneal irregularities. And our cornea is the clear dome that covers our eyes. So when you see people put contact lenses on or look at somebody from the side and you see that curve, that's the cornea. And sometimes people may have conditions where that cornea is steepened and irregular and not quite how we expect it to be. And that can be progressive. And such diseases like keratoconus, if anybody's ever heard of something like that. And that can also cause some double visioning to happen in one eye. And so those are some things that can contribute to that in that monocular case. But we can also talk about binocular cases. So when we're looking with both eyes open and we see two objects. So one of them can be due to an eye misalignment. And in the eye world, oftentimes we call that strabismus. So basically, if one of your eyes is set in one direction and one of your eyes, due to a muscular issue or whatever, is set in another direction, the brain now has two different images that it's competing with. And so you may see two different objects and well, two different signs of a single object. So you may see one object twice. Another one is thyroid eye disease. We're talking about systemic conditions now, Dr. Brown. And so there are some thyroid diseases like Graves' disease that affect the muscles in the eye. And all these muscles are kind of all around your eye and just jammed in this one area. So if you start having some muscles that become engorged or they're changing, they can in essence push or realign the eyes. And when that happens, again, we have two different views that we're dealing with, and we'll see them at the same time and get that double vision. Another thing that can happen if we ever go through some kind of trauma where something hits the eye or we get in an accident, all sorts of things like that, it can sometimes trap some of those muscles so they can't move properly. It can damage maybe the floor that kind of sits underneath the eyes that our eyes sit in, and that can cause a misalignment and a double vision as well. We also have some nerves, what we call cranial nerves, that control some functions of our eyes, whether our eyes are open or closed or move one way or the other. And those can be kind of paralyzed from different things, and that can cause us to see double as well. And a big big thing for us, for you as a patient and for us for doctors, is to make sure we rule out neurologic conditions, things that deal with the brain. And those are a big thing when it comes to double. And that's why we don't want to ignore it as well. It can be due to neuromuscular disorders like myasthenia gravis, where you have changes that are happening on a cellular level that cause fatiguing of their muscles over time. So we may start to see double as the day goes by. Inflammatory infections and or infectious conditions and inflammatory conditions like Lyme disease and meningitis, and even things like multiple sclerosis that happen in the brain can also affect things in the eye and cause a double vision. So, Dr. Brown, you can see that here we can have something as simple as that we need glasses, or as serious as that we've got something going on neurologically. So, we do not want to ignore double vision. And this and all the other things we're talking about are not fully exhaustive. There are so many reasons why these things can occur, but we want to hit on some of the big ones and the important ones and the ones that might be more familiar to the ears of our listeners and ourselves to keep an eye on. So double vision is number one that we've got here on the list.
Right. So, Doc, you laid out a lot of great information that I bet our listening audience had no clue that could be the cause or why double vision, the cause for them to have double vision. So, thank you for such a great outline. I mean, it's an eye opener, no pun intended, but for us to have that information. And the beauty of it is that all of the treatment and management and care may not always be done in your optometrist office. It may be where they are working with one of the other eye care professionals or your primary care provider or your neurologist when some of these things are happening that's causing you to have double vision. But they're going to examine and try to get to the root cause. For those who are listening, we try to get to the root cause of what's causing the double vision, and maybe having to work and communicate with other eye care specialists or other professionals when it comes to taking care of some of these problems there as well. So thank you for outlining that.
Absolutely.
That's great.
No, thank you for pointing those things out. And I totally agree. Your eye is part of your body and it's this interconnected system. So some things are isolated to the eye and some things, involve other organs and body systems. And so we definitely want to make sure we've got interdisciplinary support there so we can get help from where we need it. But we can go to our next slide and we can talk about another thing that we want to keep an eye out for. And this is a really popular one. It is red eye. And so this is when we have a red or a pinkish hue on the eye itself or the area around itself. And we want to know, hey, what's going on here? And we know, especially as eye doctors, this can mean a lot of things. And even as a normal lay person, you've seen different reasons we can have red eye. So we'll look at the next slide and we'll talk about some of the things that can cause that. And again, we can have plenty, but here are a few. So we can start with something that's pretty general and sometimes more effective in the eye than people assume: dry eye. So when our eyes are very dry, our eyes are actually covered by a tear film that has different layers on it. And it's really important that that tear film is even and consistent on our eye. But when our eyes dry out, if there's any issue with that tear film, we can get inflammation that can lead to redness, and then we can get this appearance in our eye that's not ideal. So sometimes people think, hey, I've got an infection, and sometimes you just got really dry eyes. And so even though it sounds simple, it's something that really does affect the quality of our vision and the way our eyes look and feel. And so another thing that we can have is a little bit more serious than dry eye, and it's called uveitis. And we have this area inside the eye in the middle of the eye, and it's more of an internal eye inflammation. So the eye kind of gets angry from the inside out. And so sometimes when that is occurring, from maybe an infection or an irritation of some sort, we can have a red appearance in that eye. So sometimes we think a topical drop will help the eye, but honestly, there's an inflammation going on inside of the eye that has to be addressed totally differently. So we can't just say, hey, I've got a red eye, it's dry eye, and that's all it is. It can be something a little bit more serious like uveitis. And that condition can come from, again, different maybe infections, inflammations, or even systemic conditions as well. Another thing is what we call conjunctivitis. And this word is used a lot for a lot of different things, but it's when the clear covering over the white of the eye that we see becomes inflamed or irritated. And this can be an allergic thing in nature. So sometimes people can have that triggering of inflammation from an allergen, or it can be infectious, like a virus or a bacteria can cause infection. And it can sometimes come with other symptoms as well. But we'll see this redness in the eye when we get that inflammation on the clear part that covers the whites of the eye. Another reason could be something like glaucoma. There is a particular condition where fluid is flowing from the front to the back of the eye where two places of the eye meet. And sometimes that area shuts down. And when that area shuts down, it can cause differences in our blood vessels and cause our eyes to appear red. So even things that we might not know as much about, these kind of very unique conditions can cause redness. And also even the medications we take. Sometimes antihistamines that are there can dry us out a little bit and cause some redness. Some nonsteroidal anti-inflammatories can cause it. Topical medications, a lot of the times the medications we take for various conditions that we put directly in the eye can have preservatives that keep the medication from going bad prematurely, but it also can irritate the eye a little bit. So things that we take to treat other things can also have a secondary effect of having dry eye as well.
So, Doc, I just want to just add here too. Now, this list that you've given us kind of reminds me to remind our listening audience why it's important that we do a great history when you're coming into the office there. When we give you those sheets to fill out, it's not to delay time. It's for us to gather as much information from you as we possibly can, because it will help us when we're doing the exam as well there too. So your history of medications that you've taken, any drops that you've put in, any family history, possibly any surgeries that you've had, all of that information is important as we come together in providing care for patients there as well. And you also mentioned glaucoma, which is one of the things that we try to focus on as a association and the foundation to educate people about, because it's one of the silent killers of your vision there as well. So we don't want things to rob you of sight. We don't want you to have discomfort. So that's why we're highlighting some of these signs and symptoms tonight so that you can be aware of them and you don't delay going in to see your optometrist when these things may happen as well. So thanks, Doc, for highlighting some of these things about red eye for our audience.
Absolutely. And just to tag on what you said something really important. I find a lot of patients sometimes will say, well, why does a doctor need to know my health history? We're talking about my eyes. Sometimes they understand the medications and all that stuff, but some of
Right.
these things are telling. And sometimes we learn later on that something that might have helped us figure things out earlier, because it's like, well, you never said you had that. Well, I didn't think it was
Right.
important. So even though it may be a little cumbersome, I definitely support what Dr. Brown is saying. Tell us your history, because if you have something that maybe that makes uveitis more plausible, or something that's more affiliated with dry eye, so we can kind of get an idea of where that comes from and maybe fast track the most direct route to how to treat it and kind of know where it comes from. So don't be scared to share with your eye care provider your health as well, because sometimes there's background information that can be helpful. So he makes a great point there. So we can go to the next slide and talk about our next subject here. And now we're going to talk about floaters, especially new onset floaters. And we're talking about here these dark specks or spots or cobwebs or squiggly lines that we can see in our field of vision. And so we'll go on the next slide to look at a few different reasons why we can have floaters. Again, not exhaustive, but some of the top reasons. So the first phrase we're going to have here sounds like a mouthful. It's called a posterior vitreous detachment. And that name you don't have to remember, but it is basically when the gel that's inside our eyeballs, we've got this jelly-like liquid that's in there. And sometimes it can become more liquid over time. And eventually that jelly, that vitreous, can pull away from the retina, which is the back lining of the eye that gives us vision, and cause an onset of floaters. And so sometimes it's just a change in this jelly composition that's often associated with age and time that pulls away. And most of the time it's benign. Sometimes it can have some side effects that we want to look out for. So if you ever had this, your doctor may say, hey, come back in 4 to 6 weeks for me to make sure everything in the back of the eye is still healthy. But generally, this is one that we see commonly. And it's not as much as a concern like the next thing actually is a retinal detachment. Now, that is what we don't want to happen in the eye, but it can have floaters just like a vitreous detachment can. So you can't really decipher between the two just being a person sitting down. And so this is when the retina, not the jelly in the eye, but the back of the eye that gives us our vision, pulls away from the back wall of the eye. And a lot of the nutrients that retina has to, or the retina uses to continue to keep the tissue alive lies on that back wall. So the two need to stay connected. So when that retina comes off that back wall, it can cause floaters to be seen as well. So you can have a jelly coming off the back of the eye or the retina itself detaching from the eye. Both of those can have very different indications, but they can look similar to a patient. Another thing that happens inside the eye, or that can happen, is what we call a vitreous hemorrhage. So again, the vitreous is that jelly inside the eye, and sometimes different conditions, sometimes underlying systemic or retinal issues, can cause blood to be dislodged in there. And I don't think it takes an eye doctor to know that blood inside the eyeball is probably no bueno. And so we want to make sure if you see a new onset floater, it's not due to blood now leaking inside that jelly in the eye being suspended and us now perceiving that as patients. Another thing is an inflammation in the eye. There are some things, oftentimes systemic conditions or inflammatory conditions or infections conditions, that can trigger on inflammation that's inside that back cavity of the eye. And it literally incites inflammatory cells. And those cells can be so numerous that they register to us as floaters as well. So again, we've got something as generally typically benign as a posterior vitreous detachment, and we've got bleeding in the eye, and they can all be registered to somebody as a floater. And so we'll go to the next set and the next slide, and we'll also talk about flashes of light. And sometimes we'll see flashes of light and floating spots associated with some similar conditions. But in the eye world, we also call these photopsias. And this is when we see flashes of light that can look like sparks or streaks or lightning bolts come inside the vision. And if we have an onset of flashing lights, especially ones you haven't seen before, it looks like if there's paparazzi there, it looks like there's paparazzi there and you're alone, you definitely want to get it checked out, okay? There's something going on inside the eye. We want to see what it is. So we can go to the next slide and we can talk about some reasons where we can see these flashes of light. And we might see a few things that are familiar to us that we saw with floaters as well. So we can go to the next slide and take a look at a few things there. So one of them is our good friend, the posterior vitreous detachment there, because while that jelly is pulling away from the back of the eye, it can sometimes tug on the retina and trigger some sensation of the cells that register light to us. So even though it's the jelly pulling away and the retina is still intact back there, that kind of traction between the two can register to us as light. But like we talked about before, retinal detachments can also be kind of similar. So when the back of the eye has a tear in it, or it detaches from the back of the eye, the back wall of the eye, like we talked about, it can cause flashes of light as well, because now the jelly is pulling on the eye, it's pulling on the back, it's triggering those cells called photoreceptors, and our brain registers those as light. So we can have a retinal detachment or a vitreous jelly detachment that can cause us flashes and floaters. Also migraines. Sometimes people have migraine headaches that can have associated auras, and there's specific migraines as well called ocular migraines that can produce visual disturbances. And some of those disturbances for some people are seen as flashing lights, sometimes scintillating lights or kaleidoscope images. So we want to make sure that we keep an eye out for those. For some people, it can happen like before they get a headache. Some people, it's associated when they're having their active migraine. So some people feel like they know the migraine is coming on because they start to have some visual disturbances there. So that can be also a reason. And not excitingly, we can also have lesions or tumors inside the eye. So it's not super common, but it does unfortunately happen that we can have tumors like melanomas inside of the eye, and they start from more underneath the retinal tissue. And because they can disturb the cells in the eyes as well, we can get flashes of light, or if they happen on the optic nerve that connects the eye to the brain, we can get flashes of light from those things as well. So again, from as general as another jelly detachment to as serious as a tumor, if we get new significant flashes of light that we're seeing in the vision, definitely better safe than sorry to get it checked out.
So Doc, I appreciate this. This is great information about floaters and flashes, because these are common things that people will check off on their patient history form, that they have floaters in their vision and they have flashes. And we always have to gather additional information when those things are checked off. But when they're having flashes of light, And like you said, if paparazzi is not around and you're by yourself and you're seeing this, you should get checked. Is there a window of time that you would say, hey, don't wait this long, because men, I can speak because I'm a man. We tend to delay things, and I always applaud the wives and for the ladies for getting the men into the office to get their eyes examined, because we will kick, scream, and drag, to avoid going to see an eye doctor or our primary care doctor. So help us out with some information about why they shouldn't delay this, or that window that they should get checked and not delay it when they got those flashes going on.
I would say there's not a perfect window, but my general thing is as soon as possible, right? Because if it's something like a retinal detachment, there's some ways where your retina, even though it sounds kind of crazy, your retina can come off, but it can be reattached. But you don't want something to be separated from its blood supply for too long because the tissue dies. And sometimes the retina can separate from parts of the eyes that once that separation occurs, the repair for that is not as easy. So I would say as soon as possible. You don't want to sit there and wait days and days and days. Now, if somebody says come in 15 minutes, like don't rush them and be like, I can't wait 15 minutes. But if they say get here in 15 minutes, make it there. Okay. So try to do it as soon as possible. I would say definitely don't wait like days and days or weeks and weeks. And I've had patients who unfortunately have told me, hey, yeah, a couple weeks ago I saw this and I kept checking, it didn't go away. And I look back there and there's really no hope for that particular part of the vision or the retina that was damaged. So I would say when you see something, say something. They say that sometimes. When it comes to flashing lights.
Yes, that's the message that I wanted you to bring, that you just don't delay it for several days, because your opportunity to get help and management with that could have expired, so don't wait so long to go in and get checked to receive that.
Absolutely. And if you call an eye office and tell them what's going on, they'll probably ask you a series of questions, and that'll help gauge like, okay, is this part, how much may be gone? Is this part may or may not be effective? Of course, you can't tell anything until you see somebody, but they help kind of triage you or kind of go through some questions. So if it's something they feel like, oh, it sounds like this, we'll take you in 30 minutes, or it sounds like this, 8 a.m. tomorrow because it's 5 p.m. We're going to have a surgeon there for you. Follow that guidance as well. So also be very good about your history. Whoever you call should be able to kind of talk you through when to come in. But I would say if someone says come in today, don't be like, oh, I got a hair appointment at 5 o'clock. I got to make it. Nope. Just, wrap your head up and go out there. You'll be all right tomorrow. You want your eyes. So take the guidance of the specialist, but reach out as soon as you know, for sure.
And we bring this up because we want to help protect the vision. We don't want you to lose sight, especially when it can be saved there. So follow those guidelines, as Doc just said, to make sure that we're helping to protect your vision and not lose sight as well.
Absolutely. So we can go on to our next symptoms here. And we have persistent blurred vision. So this is when our vision is blurry from days to weeks to months to years. So it's not like, oh, something was blurry and you blinked real quick and it cleared up. This is, we're talking about vision that's blurry that stays that way. So we can go to the next slide and see a couple reasons why that can happen. Couple of these are familiar. So you'll see these things come up. And that just tells us as well, Dr. Brown, that different things can present with different ways, in different ways. So it can be the same thing presented in a couple different ways. So we want to know that sometimes these things cross over, sometimes they're completely separate. But blurred vision, as a lot of the population knows, can just come from a refractive error, being nearsighted, being farsighted, having astigmatism. So needing correction in glasses and contact lenses. So even for that, it's always important to get your vision checked just to make sure you can see the world clearly. Another reason is cataracts. We talked about how cataracts are basically a lens or like the window to the eye becoming cloudy. And that cloudiness doesn't just reverse itself. It's going to stay the same or going to progress over time. And eventually it may be to the point where we need that lens removed and replaced, which is what happens in cataract surgery. But there's no like drops that take away cataracts or anything like that. We'll have to do surgery to remove it. So that can cause people to be blurry for a while too. And it can, really get in the way of normal tasks like driving. So even though it may not be a horrible medical condition, it really can affect our quality of life. So we want to make sure that if cataracts are present and causing us blurred vision, we get those taken care of as well. There's another condition that we may hear on TV sometimes or around with people we know called age-related macular degeneration. And that is where there's a breakdown and disruption of some cells inside the eye in this special place in our eye called the macula. The macula is what allows us to see straight ahead and gives us our finest central vision. So you can imagine that macular degeneration is not a good sign. And not all types of macular degeneration can bring the eye back to exactly where it was, but there can be treatments for it, and you want that intervention, especially if you have one kind or the other, because there's different forms of it. And so if you have persistent blurred vision, especially centrally, macular degeneration can be a reason for that as well. Also a plug, things like UV exposure and smoking can be increase our risk factors for that. So we want to work on those habits too that keep us nice and healthy. Another thing can be optic nerve disease. So sometimes there's something like glaucoma or an inflammation or a neuropathy where we lose like oxygen to the nerve and things like that. It can cause us to have blurred vision because that nerve is what connects our eye to the brain and transmits our vision. So if there's a defect there, we can have long-standing blurred vision. In some cases that can be helped. In some cases people stay with blurred vision and that's their quality of life. And honestly, it can also be due to retinal disease. So again, the retina is the back part of our eye that controls our vision, and we have these arteries and veins that go through. Sometimes they can be blocked, oftentimes associated with systemic conditions that are going on with us, like high blood pressure and things like that. If we have diabetes, especially when it becomes more uncontrolled, can actually wreak havoc on the back of the eye, but vessels all inside the body, but especially inside the eye. And we can literally see some of those changes, and it can cause bleeding, it can cause swelling, it can cause irregular deposits. And again, the sooner we intervene with those things, the sooner we can address them. Some of them, we can bring the eye close back to baseline. Sometimes the vision can be lost depending on how progressed it gets. And there are different stages of disease inside the eye when it comes to diabetes and some other conditions as well. So we want to make sure that if you're seeing blurry, it's not due to something that's going on systemically, because at the end of the day, yes, we'll do some eye interventions, whether it's your optometrist, your ophthalmologist, but also you need to make sure that you're managing your body with your primary care doctor and your specialist, because that's ultimately what's going to solve some of the problems. Sometimes the eye is just a tattletale on what's going on in the body. So the eye still needs to be addressed, but the honest internal thing that's going on is the primary way to make it better. So we want to make sure that we're not getting retinal disease due to various factors, especially those vascular diseases and things like that.
Great, Doc. And I pause again, thanking you for that great outline for persistent blurred vision. You touched upon another silent killer of our vision there, which was diabetes, diabetic retinopathy. Many times, patients, you come into the office and we're asking you, what about your A1C or your glucose number there? You know, when you last check your blood glucose, you know, or we might say blood sugar. Those numbers are important. We want to know those numbers. Your optometrist, the technician may ask you about those numbers. So try to keep a record of what those readings are when you go to your primary care. Your A1C gives us a kind of window of 3 months, you know, how your blood sugar has been controlled. And then also just that number where you should be monitoring your blood glucose levels on a daily, weekly basis there as well there too. All of that matters. You know, diabetes can rob you of your sight if it's not controlled. So we want to make sure that your vision is not lost. We want to make sure that you're preserving your vision and protecting the vision. So this is why we continue to do webinars like this by the National Optometric Foundation. Our great speakers come on and they share these topics there because we want to help protect the vision. So find out more about us, the National Optometric Foundation.com. Our board members are on the page. We have pictures showing us where we've worked in the community as well. We've gone to the NOA conferences. We're also on Facebook and our YouTube channel. If you'll go and like our Facebook page and subscribe to our YouTube channel, we'll be glad to have you to be a part of us and follow us and connect with us. And we want to thank you all. You know, last month, when we were in November, some of you gave, and we appreciate that. We see you. Some I know off the top of my head, Mr. Larry Hunter in Augusta, Georgia, Mr. Clarence Baylor. You guys gave and allow us to continue to do these great things that we do in the community and for our future optometrist students who are in optometry school and thinking about going to optometry school by donating to our Cash App, $ protecting the vision. So we're going to continue to go into this webinar here. We have a great speaker, my colleague, Dr. Roselyn. She's been dropping some golden nuggets with us about signs and symptoms that you should not ignore and the reason why you should not ignore those. So thank you, Doc, and I'm going to turn the show back over to you.
Absolutely. Don't ignore them. So we can go back to our presentation and we're going to check out our next thing that we want to keep an eye out for. And so here we're going to have not just blurred vision, but now a sudden loss of vision. So when your vision just goes away quickly, okay? And this can happen from seconds to hours. This is kind of the time frame we're looking on. So we can go to the next slide and talk about a few of those. And one of them we've touched on before. So sometimes people's migraines and aura can cause them to have vision loss suddenly. And it should be restored over time, especially with the resolution of the headache, but that can be one thing. But another one is a big one, and it's called a transient ischemic attack. And there are episodes where people have a sudden loss of vision called amaurosis fugax, where there is usually a blockage of an artery, and that can indicate a cardiovascular issue for somebody. So somebody has this particular transient loss of vision, and especially inside the eye, sometimes we can see blockages of our arteries. It can be a precluder to somebody having a cardiovascular event or a stroke or something like that. So if this happens, this person needs to see their doctor, and if they can, their specialist immediately, because that can be a sign that something else is coming that we don't want, that doesn't just happen with a quick vision change, but happens with our general system as well. So we definitely want to make sure that if there's any sign of what we call that transient ischemic attack, and we have that loss of vision that goes for a few minutes and comes back, we want to definitely get that checked out. Another thing is also if there's some kind of blockage of flow in those arteries and veins that are inside the eye, if they have a clot, they can sometimes lead to a lack of blood flow inside the eye. And we know that blood carries our oxygen and nutrients to and from the eye. So we want that flow to continue. And if that shuts down, our vision can be shut down as well. So we want to make sure that if we see that we have a loss of vision that's sudden, we get that checked out. And one of them is another reason is our old friend, the retinal detachment. Again, if the back lining of the eye, the retina comes off the back of the eye in certain places and even takes away the macula, which we talked about earlier, that area of central vision, if that gets ripped off, that's definitely not a good sign. So if there is a retinal detachment, sometimes you can have an episode where we lose vision very quickly. And if we feel like we lose vision very quickly and significantly noticeably, we definitely want somebody to check us out. Again, this is different than being blurry. This is the vision being very much obscured, not just, oh, I blinked a few times and, I could see my text message a little bit clearer. This is some vision going away and then coming back. And so we can go on to our next thing here and see what we've got. And this is a foreign body sensation. So this is when we have a feeling like there's something in the eye, a gritty feeling. It feels like there's something going on there. And the next slide will give us a couple of things that we can think about if we get this foreign body sensation. So one of the top reasons is it could just be a foreign body. And that just means something that's not from the eye getting inside the eye. So it can be dust, it can be debris. I've known patients who are like, I was working outside in the yard and something flew in my eye. Or a lot of times people who are like welders and work with metal, sometimes if they don't have those visors on, a little speck of metal can go inside the eye. And just anything that you can happen. Sometimes you can get a piece of a contact lens stuck in your eye, an eyelash. So anything that's coming into the eye that shouldn't be there can cause a sensation of something not being there, right? And it can be worse with blinking. And another reason can be our good old friend dry eye, because when the eye dries out, when that tear film is not how it should be, it can lead to discomfort and greediness, and it can make us feel like we have something going on inside the eye. And sometimes we as doctors will look and then we won't see anything there physically. We'll do some further examination and find like, man, this eye is just so dry. And that person has these symptoms. Another thing can be something wrong with your cornea, that clear dome over the eye. When that cornea is uneven, you can tell something is going on. So sometimes you can have an abrasion or a scratch in the eye. And because now you've got the scratch with uneven edges, you can feel that when you blink. So sometimes you'll feel like there's something in the eye. If you get an ulcer, sometimes ulcers can be what we call sterile, but a lot of times we see them from things like contact lens overwear. So that's usually when we have literally like an excavation, like a divot inside the cornea. And sometimes bacteria can get in there and start to live and burrow. And that can cause a feeling like there's something in the eye because, again, the eye is not, the surface is not nice and smooth. So when we blink, we sense that irregularity. And then we oftentimes will then try to find different ways to solve it or go see somebody for it. Another thing is contact lens issues. If you're wearing your contacts for too long, or if they're not fit properly. I know sometimes people don't know, don't feel like contact lens fit matters, but it does. So we at the doctor, when we bring you back and we want to look at how contact lenses sit on you, we want to make sure that's proper because that can cause irritation or kind of indentations in some parts of the eye. And that can lead to us feeling like there's something in it. Also, we've got something called blepharitis, and that is a word where we're talking about inflammation around our eyelid margins. And when we get inflammation around our eyelids, that can lead to irritation and dryness, and sometimes even debris getting inside the eye. And so we start to feel like there's something in the eye. Another thing is kind of a funny word. You don't have to remember this word, but it's called trichiasis. And basically, sometimes it's even due to the way people's eyelids are set or just the way their eyelashes grow. Sometimes your eyelashes can be misdirected toward the eye. So it's like an eyelash rubbing your eye every time you blink and look around. Sometimes it can even cause little scrapes as you're looking up and down, and somebody feels like there's something in the eye, but it's like an eyelash that's just directed and it just doesn't really go anywhere. So sometimes we as doctors do what we call epilation, where we just pluck that lash out so it will free up the eye and you won't feel like there's anything in there anymore. So a couple of causes of foreign body sensation there. So we can go to the next slide and talk about our next thing here. And it will be light sensitivity. So we sometimes have conditions where what we call photophobia can occur, and that's when we have a significant discomfort to light exposure. And in the next slide, we'll talk about a few different reasons we have that. Again, some of them will be our familiar friends, some of them will be something different. So one, again, is that inflammation that can happen inside the eye called uveitis. It can lead to light sensitivity and discomfort. So that's something that we always consider when people say that they have light sensitivity. Also, if you get something wrong with the surface of your eye, that cornea, so an abrasion or an ulcer, that damage to the surface of the eye causes us to have a sensitivity to stimulus that are really, really bright. And then severe dry eye. Again, that surface of the eye, because it's so dry, gets so irregular, it can cause light to scatter differently, and we can be more sensitive to bright light and glare. And another thing is medications. Again, some antidepressants and anti-anxiety medications like benzodiazepines can cause our pupils to be larger and cause light sensitivity. Some erectile dysfunction medications, some mydriatic medications. So if you've ever gone, on a cruise and you get one of those patches that are for you to not have seasickness, one of the side effects of that particular medication is also dilating the eyes. And when the eyes dilate, that means they stay wider. And it's like opening up a window even wider. When you open a window wider, you let in more light and you're more sensitive to light. So sometimes even the medications that we take can contribute to that. I know some chemo meds can do that as well. So we'll also keep in mind things that we're treating other things with can also cause changes to our eyes or our likelihood of being more sensitive. And so we can have some light sensitivity there. And then next, after light sensitivity, we're going to look at swelling in or around the eye. So we'll see that on the next slide. So sometimes we'll have swelling of the eyelid itself, and sometimes the tissue that surrounds the lid, and sometimes those can tell us different things. So we can go to the next slide and look at some reasons why we can get some of that swelling. One of them is our friend blepharitis, that inflammation of the eyelid. And so sometimes we can get crustiness and redness and swelling, and that can often be due to inflammation or like bacteria that on the eye that become overgrown on the eyelid. Another one can be is if we come in contact with something that's an irritant or an allergen. So sometimes we've encountered something, you may touch something and touch your face, or be in an environment where something bothers you, or maybe a product, and that can lead to swelling around the eyes. So sometimes people find out their detergent is something that they're allergic to, or when, pollen season comes around, that can be effective as well. But one of the ones that we see the most is the next one, a chalazion or hordeolum. These things are kind of like cousins sometimes, but it's when we have a blocked oil gland that's on the eyelid, or an infected and inflamed oil gland that then can cause swelling and pain and redness. So when it's just an inflammation, that's just a swelling, we call that a chalazion. When we get an actual infection and that redness and that hot, angry feeling, that's a hordeolum. But those are the ones that a lot of people can see on their eyelids, and they're like, hey, doc, I have a sty. What can I do for it? Depending on which one of those two it is, it'll tell us what to do for it. And another one is called cellulitis. And this is not as well known sometimes, but we have a part of the eye that separates some tissues. And if you have an inflammation of cells in one part, you want to calm that down, because that can actually break that barrier and go to the tissues of more of your face and inside. And that can actually be something that can be health threatening. And so if you find that you're getting swelling, but then you start seeing it come on your eyelid and down your face, that can mean that you're getting inflammation of the cells inside. And that's something that we would probably need oral medications to solve. And so if you see those things occur, definitely let us know.
So one of the things that I want to interject here, Doc, and just tell some of the patients, some of these things that Doc has outlined here are not covered by your routine vision insurance as well. Okay, so just want to say that, because many times you may call to the office and you're asking for an eye exam, but you're really having these things going on. You probably should let them know that you're having those things going on first, because instead of them scheduling you out to February, they will probably be able to work you in sooner, because it's going in as an office visit. So just want to highlight that to you, because we have that happening often there, where you're calling and you say you need an eye exam and you got VSP insurance or iMed insurance. They're not going to pay for the doctor to see you for some of those conditions that she's outlined there. Your medical insurance, if you have that, may come in and help cover some of the costs for your office visit. Just want to highlight that.
Yeah, and absolutely. And sometimes patients will say, well, can you do both? Well, really, we want to address the problem first and foremost in one exam, and then we can check your vision. And a lot of times, some of these things will affect your visual quality. So there's some things where if we did give you glasses that day, you wouldn't be able to see well in them, or they wouldn't be as accurate, and you would be back in the chair anyhow. So we want to make sure that the eye is ideal. Everything is solved. The surface is normal, your lids are normal, there's nothing else going on, because then we've got the best clean slate to start with to give you ideal vision. So if you ever have something actively going on, it's in your best interest to allow your doctor to treat that thing first. Let's do what we've got to do to resolve it, however that looks. And then let's come back and check your vision for a general visual exam to make sure everything universally is good. And we check your glasses and contacts and et cetera. So that's a great point, Dr. Brown. And one of the last symptoms we'll look at here is one that comes a lot, and it is eye pain. So we're talking about when we have a notable pain or discomfort that happens in or around the eye. So let's look at some reasons that can happen. And again, some of them will be our old familiars and some of them will be new. So we'll go to the next slide and see a couple of things that can happen. So one of them are infections in the eye. So whether it's an infection of the clear tissue over the white of the eye, of the cornea, we can get redness and swelling and sometimes significant pain. And the same thing can happen if we have anything happen to the cornea, that clear dome on the surface of the eye. So if we have trauma, your cornea actually has a lot of nerve endings with it. So when something goes wrong with the cornea, you feel it. So that's something that I usually don't have to tell patients to come in for. They'll come in on their own if something happens with their cornea most often. But if we have trauma to that area, if we have a scratch of the tissue on the top, if we get ulcers where, again, we've got kind of like the excavation that can happen, even UV burns and chemical exposure. So some people, when they have an excessive amount of UV exposure, they can get like a sunburn in the eye, if you've ever heard of that. And just as a side note, two of the surfaces that reflect the most UV are water and snow. And so if you're outside on the water, if you like the ocean, or if you're snowing, those eye shades and things are very, very important to protect your cornea for sure. Another thing is our friend uveitis, that inflammation that can occur inside of the eye, especially the movement of particular muscles can leave us not just light sensitive, but also give us pain. And so we want to go to an eye care specialist to help that, because that's not something we can just topically treat and it'll be okay. Another one is what we mentioned earlier in the program, where we have that area of fluid flow that closes up and the fluid gets backed up in the eye, and then it causes pain to happen. If we have poorly fit contact lenses, that can occur. And there's something that we haven't talked about that I want to touch on real quick as well. And it's, again, maybe not the most common condition, but can really, really indicate things that are going on in the body. And it is called scleritis. So we've talked about conjunctivitis, and that conjunctivitis has to do with the conjunctiva, which is a clear tissue that covers the white of the eye. But we haven't talked about the white of the eye itself, and that is called the sclera. And so the sclera itself can have an inflammation, and it can be sometimes very intense, but this often has a high association with some systemic diseases that needs to be followed up. And sometimes the consequences of scleritis can be quite significant. So it can relate to rheumatoid arthritis, to lupus, to polyangiitis, to all sorts of conditions. So sometimes you'll think, oh, it's a natural red eye, but if it's that deeper tissue, it has a very different significance than if it's that superficial clear tissue that covers it. So again, an eye doctor should be able to look at that and kind of help discriminate the two, because that will very much guide how serious it is and what we do about it. And one of the last things, again, maybe not one that's every day, but if it happens to you or somebody you know, it's going to be the most important thing that you hear, is sometimes issues with the optic nerve. So the optic nerve, again, connects the eye to the brain. It's our pathway to vision. And sometimes there can be an inflammation in that nerve, often associated with conditions like multiple sclerosis. But one of the things people may have is pain. And so sometimes when your eye doctor is having you move your eyes around, they're checking muscles, but they may ask also, tell me if you have any pain, because sometimes with the eye muscle movements, we can have pain as well, but people can also sense pain with optic neuritis. So again, anything as simple as an infection from your contact lenses to an inflammation inside the optic nerve can be a reason that we have eye pain. So again, this is not necessarily an exhaustive thing of everything to look out for, but there's some top ones there. So we'll go to the next slide. Just some things to keep in mind. We want to just be sure we remember that getting key symptoms and getting those things taken care of is essential, because things can become more serious over time, and a timely evaluation allows us to avoid preventable vision loss. I mean, just discomfort anyway. Who wants to have pain or double vision or things longer than we have to? Improves quality of life, and it supports long-term eye health and also long-term systemic health if we find that things are interrelated. So I would just always encourage everybody to make sure that if something happens, like we say, anything out of the ordinary, go get it checked out. Safer than to not let it get evaluated and it be something that's more serious.
Absolutely.
And yes, and so I'll just say, if there's any questions from Dr. Brown, we'll be happy to answer them. But on the next slide, I just want to say a big thank you to Dr. Brown, National Optometric Foundation, the NOA, for having me here, help close out the year and share a little bit of what I've got. And so I really appreciate you guys. And if you need to contact me, there's some contact lens information. There's some contact information. I've been talking about contact lenses tonight. There's contact information for me at the end. But thanks so much. And if you have any other questions or comments, Dr. Brown, you've always got great input. I'm glad for that as well.
This has been absolutely amazing. You have outlined some great information for our listening audience. Definitely common signs and symptoms that should not be ignored. You gave great detail why they should not be ignored. You explained it to them. So this is going to be a webinar that many people will be able to share with their family members to make sure that we're passing on this education that you provided tonight. So thank you, Doc. I appreciate you for outlining and laying out that information and sharing those golden nuggets with us there. This has truly been a great webinar and a great way to close out 2025. So thank you so much for closing the lid here for our webinars for this year. And I enjoy having you up here. And You represent PCO very well. Thank you so much, indeed. If there's anything else that you guys would need to know about Doc, or you need to know about the webinars that we're doing, you can go on our website. They're on our YouTube channel as well, and our Facebook channel. We have the connection there. As we're closing out this webinar, I just want to remind you that your body is going to speak to you. Often the body speaks to you before it breaks. And we want to make sure that when you're noticing these changes, you know, you might be getting fatigue, you may be in pain, or you're getting some of the subtle symptoms. It's convenient to ignore them, but I want to encourage you not to ignore them. These conditions that she mentioned, diabetes, hypertensive, glaucoma, autoimmune diseases they may be silent, but they can impact your life and be life-changing when you leave them unchecked there. So make sure that you are not delaying, putting your health first, making sure that you're getting checked. Prevention begins with awareness, and awareness begins with you. My name is Dr. Timothy Brown, the Director of Education for the National Optometric Foundation. It's been a pleasure to have another webinar, our last webinar for 2025 for you, and we hope to see you in 2026. Merry Christmas, Happy New Year, and thank you guys for tuning in. See you on the next one.